to my channel.
Meh.
So for today's video, I'm gonna share with you those useful strategies that might be helpful for you on answering the board exam. So let's proceed.
Yeah.
One thing for sure, the most common strategy is the process of elimination,
Oh, come on.
on which you will just eliminate those choices with possible wrong answers. Like for example, a situation of to assess orientation to place in a client suspected of having dementia of Alzheimer's type, Nurse Chris should ask. By using the process of elimination, it will be easier for you to find the right answer, because you already know that you are searching for a question that assesses orientation to place. Just seeing the choices below, the first one to eliminate is letter B. Who brought you here doesn't answer the question of orientation to place. And the next one to eliminate is letter D. How long have you been there is just a matter of question that asking you about time and not place. So you are left with the two choices of where are you and do you know where you are? Letter C is answerable by yes or no. Compared to letter A is answerable by a specific place that gives you hint the assessment of orientation to place. So the correct answer is letter A.
Wow.
Another strategy is watching out for the umbrella effect. Some questions do have an umbrella effect. Like for example, a client asked the nurse what a third-degree laceration is. She was informed that she had one. The nurse explains that this is, according to the question, you must have a general knowledge of what is a laceration and its degrees. So, by using the umbrella effect, you knew that third-degree laceration also contains the second and first-degree laceration. So, by seeing the choices below, letter B, C, and D describes the second-degree laceration. And because of the umbrella effect, second-degree laceration is also under to third-degree laceration, meaning all of that are part of a third-degree laceration. So by reading letter A, what extends to the anal sphincter is also an additional information about third-degree laceration. So your final answer will be letter A, because according to the umbrella effect, B, C, and D are already under to the third-degree laceration. Another strategy is knowing about your job description. As a nurse, you must know your limitations of your work and what is the description of your job. Here is a sample of situation. CHN is a community-based practice, which best explains this statement. By reading the choices below, the most powerful one is letter B. The nurse has to conduct community diagnosis to determine nursing needs and problems, which is also correct according to the description of your job. Compared to the other answers, letter B is the best answer. Another strategy is you must know how to prioritize. You must have the basic knowledge of ADPI or ADUPI. You must know that assessment always comes first. So here is an example. A male client receiving prolonged steroid therapy complains of always being thirsty and urinating frequently. The best initial action by the nurse should be as. So by just reading again the question, you are searching for the best initial action of a client that is always being thirsty and urinating frequently. Being thirsty or polydipsia and urinating frequently or polyuria, 2 out of 3 manifestations of a diabetes mellitus. You are suspecting a client with DM. And by best initial action, you must find first an answer that talks about assessment. Letter D is assessment, but it does not talk about the diabetes mellitus. Letter B is an absolutely wrong because you are passing the bucket. And passing a bucket is a very big no-no. Letter C, obtaining a urine, does not let you know that the patient have DM, unless it is ordered by the doctor. So the best answer is letter A. The client has a sign of diabetes which may result from steroid therapy. Testing the blood glucose level is a method of screening for diabetes, thus gathering more data. Another strategy is learning the basic. These basics are already discussed during your nursing course. So the strategy, what comes on your mind first is the best answer, is very applicable. Because most of the information from your nursing course are already stuck on your subconscious mind. So you just need to trust yourself. What you pick first is the right answer. So here's another example. One of the very simple question of nursing licensure exam. Who is the chairman for the Municipal Health Board? So if you are already familiar in this one, what comes on your mind first is the possible correct answer. So just by looking at the choices below, the correct answer is the mayor. This information must already discussed during your nursing course. So you must be aware this kind of knowledge. So the local executive serves as the chairman of the Municipal Health Board, and that is the mayor. Okay, for the next strategy is the underline, circle, square, and star. Yep, and those are the 4 shapes, which is very useful in answering some questions on the exam.
Yeah!
This strategy differs from any individual. So I'm gonna share how I use this strategy. So I'll give you an example first. In integrated management of childhood illness, severe conditions generally requires urgent referral to a hospital. Which of the following severe conditions does not always require urgent referral to a hospital? So what I do is, I underline first the IMCI because that information is kind of important. So it must be highlighted. And don't worry, during the exam it is okay to write on your questionnaires. The next is, I circled the word severe conditions. I did that because severe condition is the most important word from that question. And next is, I boxed the word does not always require, and I additional it with a star, which means I must look at it always. I always put star to questions which has lines like does not have, do have, which is not, which of the following, not applicable, and many more. So by using this strategy, it is now easier for me to determine important information on the questions given. So among the 4 choices, the choice that does not always require urgent referral is, let's do the process of elimination. The first one to eliminate is letter D, the severe febrile disease, because that is a very urgent referral to a hospital, because the patient will be in danger if not. Next to eliminate is the severe pneumonia. You are dealing breathing of the patient, which is very vital. So anything that makes severe diseases of breathing requires urgent referral to a hospital. So you are left with the 2, mastitis and severe dehydration. I know that some of you eliminate severe dehydration because it is severe, but to tell you the truth, you cannot eliminate severe dehydration. Instead, alpha, mastoiditis is eliminated. Why? Severe dehydration does not require urgent referral, because the order of priority in the management of severe dehydration is as follows: IV fluid therapy, referral to a facility where IV fluids can be initiated within 30 minutes, Orisol or Orem. But when they are impossible or ineffective, then urgent referral to a hospital is done. So that is why the answer is letter B. Severe dehydration does not require urgent referral to a hospital. The next strategy is to always rationalize your answer. By rationalizing your answer, it will help you to lead to the correct answer. Like for instance, which procedures or practice requires surgical asepsis? Looking at the choices below, this is how you rationalize. Caregiver must use surgical asepsis when performing wound care or any procedure in which a sterile body cavity is entered or skin integrity is broken. To achieve surgical asepsis, objects must be rendered or kept free of all pathogens. Inserting an IV cannula requires surgical asepsis because it disrupts skin integrity and involves entry into a sterile cavity, which is the vein. The other options are used to ensure medical asepsis or clean technique to prevent spread of infection. The GI tract isn't sterile. Therefore, irrigating a nasogastric tube or a colostomy requires only clean technique, not surgical technique. So that will lead you to the answer of C, IV cannula insertion. So for the last strategy that you must always remember during the exam is to relax. Relax and don't panic, don't overthink. Just think happy thoughts, do breathing exercise, and relax first before you answer your exam. So that's all for today. Thank you for listening. And please don't forget to subscribe and comment down below for any suggestion. Thank you everyone.